paracervic. Dorsolateral attachment of the cervix, tissues that surround the uterine artery between the uterine corpus and pelvic sidewall, cranial to the ureter, connective tissue, and lymph channels. Vesicouterine ligament. After complete separation of the uterine artery and superficial uterine vein from the ureter. The genuine connective tissue of the anterior leaflet of the vesicouterine ligament, that is the anterior portion of the so-called ureteral tunnel, can be identified. The posterior leaflet of the vesicouterine ligament is the tissue residing under the ureter, connecting the posterior wall of the bladder and the lateral cervix upper lateral vagina. Uterosacral ligament. Fibrous tissue and non-striated muscular fibers that are attached to the front of the sacrum and travel from the uterus to the anterior aspect of the sacrum. Nerve preservation. Identification of the hypogastric nerves and the inferior hypogastric nerve plexus and its bladder branches, allowing resection of oncologically relevant paracervical structures while preserving the sympathetic and parasympathetic innervations of pelvic organs. Classification of a hysterectomy. Type A, minimum resection of the paracervix. This is an extrafascial hysterectomy. The paracervix is transected medial to the ureter and lateral to the cervix. The ureter does not need to be unroofed. The uterosacral and vesicouterine ligaments are transected closely to the uterus. The length of vaginal resection is generally less than 10 millimeters, without removal of the vaginal part of the paracervix. Type B, transection of the paracervix at the ureter. Partial resection of the uterosacral and vesicouterine ligaments is a standard part of this category. The ureter is unroofed and rolled laterally, permitting transection of the paracervix at the level of the ureteral tunnel. The neural component of the paracervix caudal to the deep uterine vein is not resected. At least 10 millimeters of the vagina from the cervix or tumor is resected. Type C. The paracervix is transected at the junction with the internal iliac vascular system. C1. With autonomic nerve preservation. C2. Without autonomic nerve preservation. This type involves transection of the uterosacral ligament at the rectum and vesicouterine ligament at the bladder. The ureter is mobilized completely, and 15 to 20 millimeters of vagina from the tumor or cervix and the corresponding pericolpos is resected, depending on vaginal and paracervical extent and on the surgeon's preference. In type C1, the uterosacral ligament is transected after separation of the hypogastric nerves. The bladder branches of the pelvic plexus are preserved in the lateral ligament of the bladder. If the caudal part of the paracervix is transected, careful identification of bladder nerves is subsequently required. For type C2, the paracervix is transected completely, including the part caudal to the deep uterine vein. Type D. The entire paracervix is resected. Type D is divided into two types. D1. Resection of the entire paracervix, along with the internal iliac vessels. D2. Resection of the entire paracervix, with the internal iliac vessels and adjacent fascial or muscular structure. This rare type of operations is characterized by additional ultraradical procedures, primarily indicated at the time of pelvic exenteration. Type D1 is a resection of the entire paracervix at the pelvic sidewall along with the internal iliac vessels, exposing the roots of the sciatic nerve. The procedure involves a total resection of the vessels of the lateral part of the paracervix. These vessels arise from the internal iliac vessel system. Type D2 is a D1 plus resection of the entire paracervix, with the internal iliac vessels and adjacent fascial or muscular structures. Lymphadenectomy. Types of lymphadenectomy by level. Anatomically, arteries are the most stable landmarks for lymphadenectomy. 4 areas or levels are defined according to corresponding arterial anatomy. Level 1, external and internal iliac. Level 2, common iliac. Level 3, para-aortic, inframesenteric. Level 4, para-aortic, infrarenal. If the other lymph nodes resected, specify it.